Oh, welcome. Today we are very lucky to have Ian Miller. Ian Miller is known to many folks, certainly who've been following COVID in the social media universe. Ian is, um, has a lot of incredibly deep and drill down takes over the course of the last 2 years, specifically on masks, specifically on mask mandates. And he's kind of held the feet to the fire of many of the experts that have been telling us all kinds of things. So, Ian, welcome to the show.
Thank you. Thanks very much for having me.
Ian, tell me a little bit about how exactly this got started. By the way, I should mention that Ian has written a book that just came out a few weeks ago. If you Google Ian Miller or you Google anything, unmasked, that's the name of his book. That's the first thing that pops up. So it's doing really well, I understand. So yeah, congrats also for writing the book and the reception it's received. And there's a bunch of pretty very prominent folks that I saw that are boosting it as well. So congrats on that too, Ian.
Yeah, thank you. It's been pretty exciting. I'm glad the people have liked it and enjoyed it and found it useful. And it's one of the goals was to try to give people one reference to look at, as opposed to saying go look at a Twitter feed or go look at read 50 articles about this. It's kind of just nice to say like, here, go check out this or look at this image. So as far as how I got started in it, I have a background with data management, data analysis. Nothing too extreme, but I kind of was interested in the data very early on, especially being in California. We've had a lot of very strict COVID policies here, and I kind of wanted to see the results myself. Like, what we did all this stuff. What has been the results afterwards? Has there been an impact from these policies? I think by summer 2020, I was pretty clear to me that it really wasn't having a dramatic impact because LA, which was one of the strictest places in the world, really with COVID policy, was seeing a big increase at that point. And there were a lot of people that were doing a lot of this great work, but sporadically. And I thought, well, I'm going to do this every day. I'm going to look every day. What can I find? What's out there? And then very quickly it became apparent that there are a lot of people all across the world, really, and especially the United States, that wanted to see this for their area. What's happening in New York or what's happening in Pennsylvania or Chicago or anything like that. So, it just became kind of a consistent goal of mine to look at this every day and say, what are we doing around the whole world, and is it working?
Yeah, and and again, kudos to you in terms of for the amount of effort that this must have taken. Because honestly, when it comes to COVID, and I mean, and the response and stuff, of course, everyone has lots of opinions, but especially for I know Michelle and me too. There's just it can get so dense. The rabbit hole is so deep. You don't even want to like start heading down there, right? Because it's just like so messy to like try to get in the weeds of like what is the data on mask mandates, what is the data on masks, because you always feel like you're going to have some smart aleck from somewhere come up with some randomized control trial in Ilongo, Africa. I totally made that city up. Saying that, oh, obviously this works, and oh, the basics. And there will be some aerosol scientist that'll appear out of the blue to say that no, actually, of course, this is obvious stuff. And it's like, my God, I can't even begin to do it. So like I honestly, kind of try to stay. I kind of try not to comment too much on like the empirics, get in the weeds of it as much. Now, you, of course, have gotten in the weeds a ton, and I part of the thing, the reason I really liked your book and the reason we asked you to come on was because I think you lay it out really, really well in the book. So you've organized it really well. That the first, you start with talking about what the guidance was for pandemics and masks. Prior, the world knew because I guess Hollywood, there were enough Hollywood movies on pandemic outbreaks. So the world knew that a pandemic was coming, and someone somewhere in government was in the WHO or whatever was planning this stuff, and they had some pretty strong opinions on masks. So what did you what did you find?
Yeah, there's a lot of great points in there actually, and it's stuff that I've come up against myself all the time. But it's pretty easy to combat this when you kind of have the facts on your side, which I feel like we do, and or at least I do, and I've tried to do the research on it. And with the book early on, what I realized is that there was this wealth of resources that nobody paid attention to because again, like nobody thinks about a pandemic coming until it's already here. So, but the people that were paid to think about this beforehand did think about it, and they did these planning scenarios. And it wasn't just for something that was a mild flu; they did it for severe pandemics, like with COVID. And all of their guidance never really mentioned masking as an important strategy or an important tool to implement during a pandemic. And especially, when we talk about aerosols, the UK had done a report on this in 2011. I think they referenced it again in 2019, where they say that masks don't stop aerosols. Obviously, nothing's changed around masks. It's not like we're using the masks that they were studying in 2011 are different than the masks that people are using today. It's also important, I've referenced this before, but in late March, Dr. Fauci was sent an email from one of his employees at NIH saying that they reviewed all the randomized controlled trials on masking, and all of it suggested there would be no impact from masking the general population. April 3rd, the CDC and Fauci come out and said everybody should wear a mask. So, I think it's pretty clear when you go back and look at these planning documents and early communications, private communications, there was no evidence to suggest that it would work in the general population. And especially not just because, and this is the thing that Fauci has tried to say later on, I said those things because I was trying to protect for healthcare workers. But in private emails, he was telling people, I don't recommend that you wear a mask for all of these scientific reasons. And that basically echoed all of the guidance that I was able to find pre-COVID. So I think it's pretty consistent that all of these major health agencies realized that there wasn't really going to be a significant benefit from mask wearing. So why they changed, I don't know, but that was kind of what the research showed.
Yeah, and you nicely, you have this, he changed his opinion, whenever he changes his opinion, and then the BuzzFeed, I guess, right, had this Freedom of Information Act, and there are these email exchanges between Fauci and other folks where he kind of, says, masks are really not effective. I mean, I'll quote, this is again Anthony Fauci. This is again from your book, writing an email to somebody who was asking, how should I bring my mask? He says, the typical mask you buy in the drugstore is not really effective in keeping out virus, which is small enough to pass through the material. It might, however, provide some slight benefit in keeping out gross droplets if someone coughs or sneezes on you. I do not recommend that you wear a mask. Is there a kernel of where we eventually landed at? Meaning, he's saying, this idea that, so he's not really saying necessarily that the mask won't work at all. There may be some minimal effect by catching droplets, which the viruses are catching through. Is there anything to that?
Well, I don't think so. I don't think it fully explains the dramatic shift. I think it was very illuminating to see that, and that's kind of echoes what he said on 60 Minutes. And my goal with that was really to show that his later the statements that he was making, that it was to protect supply for healthcare workers, doesn't hold up, because he was telling people privately, here's why it won't work. Not, we're trying to be careful about recommending higher quality masking for the general population because we don't want to take supply away from healthcare workers. It might not block the virus particles getting through a mask. And that kind of lines up again with what I was saying a minute ago, with all the guidance from what pre-COVID said, that masks just can't stop virus particles, just too small, especially with aerosols. And droplets, I think early on was considered the main route of transmission. The World Health Organization, I think I put that in the book as well, kind of famously said there is no such thing as aerosol transmission. It's not happening. And masks, I think when you go back and look and they show it's not stopping aerosols, as soon as it became widely accepted that aerosols were the dominant route of transmission, all of the rationale for this made no sense at that point. So I don't, to answer your question, I don't really know if it goes to explaining his change of guidance. My personal view is just that I think that they saw what they thought was a success of countries like South Korea and Japan of what they thought was controlling COVID with masking. And they said, well, maybe we should try that here. I think that they were hoping that it would give people confidence to leave their homes again after the lockdowns ended, where, we forget that the numbers that the organizations were throwing out about how lethal COVID were huge. I mean, it was 3.5% or something like that. And a lot of it might have just been as a reminder, and we're seeing that kind of now, I think, in some of the experts that are talking about it now, that a reminder that we're in a pandemic and it's time to take it seriously. So that's kind of my personal view of why that changed, but it's interesting to review those emails.
Right. Yeah.
Before we get, sorry, Anish, before we get deeper into the weeds of things, because I'm still curious about how you, as a sort of a layperson, got into it. First of all, as Anish said at the beginning of your book, you talk about, it's great. You describe the state of the art in pandemic response before COVID, right then. I suppose that's relatively easy to find. You go on the CDC website and the WHO, and it's not too difficult, right, to find these reports on pandemic preparedness. But what about you mentioned you decided at some point to make this a sort of a part-time job for yourself, or a hobby where every day you go and look for the data. How do you determine what your sources are going to be, and how did you work that out?
Yeah, well, there was a group of people that, especially mostly on Twitter, that we all kind of would communicate and talk about COVID policies and what was going on in our certain areas. And once the COVID tracking project got underway, they provided this very easy download of all their data every day for the US states, where you could just take California, they just tracked it, and with volunteers really that went by state, download an Excel spreadsheet, and then you can create a graphic on your own. So that's basically what I would do early on, is I would just download the data from the COVID tracking project. And then it got me thinking like, okay, well, what about other areas? So then I would go to Los Angeles County, for example, their public health dashboard, which they started up, I think, sometime in April or May of 2020. You could go back and download all the data. And initially I would use it to try to show how the numbers that you would see every day on the tracker on the side of the TV broadcast were often cases and deaths that had been recorded that happened months ago. Mm-hmm. And so you could see LA County would show every day, here's the change and where those numbers actually came from. And oftentimes they would be reporting a death that happened in May in August. So I started doing it for that side of things, and then just kind of spiral where all these sources were providing the information by county level. And then the World Health Organization has a country level download that's very simple. You can it's literally, you go to their world COVID tracker map and hit download, and they give you a full Excel spreadsheet. So the sources became pretty easy to find. And I've made that point to people before. It's like, it's their own fault. They made the data so easily accessible. It's really easy to show, here's what happened afterwards. So, and I'll tell people, nothing I'm doing is that complicated. I can walk you through how to do it yourself. It doesn't take very long for each individual chart. The hardest part is actually looking up, okay, well, when did this happen and when did that happen? So that's kind of how I got into it and where I was going for the information. COVID tracking project shut down, so I started using the New York Times, which was doing a similar thing. But that's been most of the data for the U.S. sources, and yeah, so it's kind of from everywhere.
One of the interesting things that I wanted to try to differentiate is masks, or I'll ask, I guess, would you say that there's a difference between mask use in the community setting and mask used by healthcare professionals in a healthcare setting, in hospitals and in clinics?
Yeah, I would say so. I mean, obviously there's a much greater chance of it working in a healthcare setting because the people there are theoretically going to be more trained to use it properly, and they're going to be washing their hands every time. They're going to be disposing of it properly, not going to be reusing the same mask 30 times and putting it in their pocket or hanging it off of a rearview mirror in a car or on a table at a restaurant. Theoretically, that would have a larger impact. I would say that the research I had looked at as far as what it could accomplish in a surgical setting, and that's one thing that I'm sure you both could speak to, but pre-COVID, there's this assumption, well, masks work because doctors wear them. But, when you went to go see an ear, nose, and throat specialist in 2019, they weren't wearing a mask. It was just surgeons in an operating theater, or operating room. Well, that's a totally different purpose in trying to prevent the spread of a respiratory virus. And in the research I'd read was that it doesn't do a great job of preventing droplets and bacteria from getting into open wounds, and sometimes it will collect on the outside of a mask, even in surgical settings where people are obviously using it properly and using proper hygiene. So and also with N95s, I mean, that's something that if you were getting it fit tested, which could be much more feasible in a healthcare setting, that theoretically would provide the most protection. Although the Cochrane Library did a review of this and found that there was no difference between N95s and surgical masks in terms of reducing infections. Yeah. So in theory, it would probably have the best chance of working in a healthcare setting, but I don't know that there really is a lot of great evidence to suggest that it would work even there. And I'm sorry for the long answer, but the CDC actually does this tracking where they show special populations and the numbers by special population, and healthcare personnel have had rates that exceeded the general public for most of the pandemic. That makes sense. They're exposed to it a lot, but it's also showing that it's not working that well even in those areas.
It is really interesting. you mentioned the fact that the WHO and I forget some other pandemic preparedness agencies or whoever, these public health folks who were paid to do this before, they had very different guidance as to what to do with masks, right? Prior to pandemic, and suddenly, April 2020, everything changes. And I think you're, I mean, we're speculating, but I think you're hitting the nail right on the head in terms of why that happened, right? They saw these things happening in other countries. They were like, they wanted to appear decisive, do something, and they're, masks are a very visual kind of way of kind of saying that, hey, we are doing something, and it's not like we're just sitting around while this thing is spreading like wildfire. And maybe they'll work. So yeah, that all that may be fair, but certainly it's not science based. But
Yeah.
of course, one of the things is, you don't think very highly of public health experts who are making proclamations at this point, right?
Yeah.
I mean, you very much want them to, all right, show me the data. Don't just be like, I'm an expert and this is what I think goes. Whereas in 2018 or 2019, if somebody said that, you'd be like, okay, what do I know? I'm like, some random person. So, but of course, now that you know what the WHO, the CDC, what those public health officials are, because, unfortunately for them, they're sitting on TV saying all kinds of ridiculous things all the time that are demonstrated to be false, like, 2 days later. Why trust the WHO and the CDC public health officials from 2019? Maybe they're getting it wrong too.
That's a very good question, actually. Maybe they never were very competent to begin with. I would say that there's much more likelihood of them being right pre-COVID because there was much less pressure on them to give an answer.
Right.
As you say, they had to do something. They had to show that we're doing something to prevent the spread of COVID. Back then, they didn't have to do that. So there's much less likelihood that they'd be kind of politically pressured to do something. I think that I just spoke to a doctor from the UK, retired NHS doctor, who brought this up, and I had forgotten about this. But Deborah Cohen, as a BBC journalist, had said that early on, the World Health Organization wasn't changing their recommendations on masking. Kind of forget that, but early 2020, they hadn't changed. And then they did change it. I think it was by June or something like that. And she had said, there was concern that it was because of political pressure. And when she asked them, they didn't deny it. Right. There you go, right?
Yeah. And I think, I'll quibble only slightly with you and say that I feel like public health officials, they are all about, and this happens, I think this also happened to Dr. Fauci, they're all about justifying whatever it is they're doing to satisfy some end that they've all kind of agreed upon, right? And so I'll tell you a little story. Early on, I wrote about masks like March 15th of 2020 or something like that, right? March 12th, I remember that day being like, oh my God, this thing is like hitting the fan here in Philly. We're right next to New York City, and you don't know what to do. And we don't know anything about the virus. We don't know how exactly fatal it was. There's all these, there's so much speculation. It's hard to remember what a fog it was then. And we didn't know anything. And I got a consult to the ER, and I was convinced that I'm sure there are COVID patients there, right? And and I know that nothing is set up. There's no isolation set up. There's no vacuum room set up. Nothing. There's air negative pressure room set up. So I'm going to the ER, so I put a mask on, right? I put just a surgical mask on because that's the only thing I had. I didn't have an N95. And I go over to the hospital, and while crossing the lobby, some administrator stops me and says, "How are you wearing a mask on? You're going to scare everyone. Take that mask off." I mean, it's and obviously anyway, the whole wrong. They're the one thing that's consistent about this is administrators will always be wrong about everything at any time. But and so I started reading a little bit because again, I'm a cardiologist. I know nothing about mask science, right? And I still know 12 times more about mask science than I do at this point. But I read a little bit, and it was really interesting to see how it is the public health folks kind of came to their decisions, right? So consider Ebola, all right? Ebola is not considered to be highly transmissible via the air, right? And there's this whole big debate this rabbit hole you go down. I don't know if you saw it between droplet and aerosol, et cetera, but whatever. It is not considered to really be that much through the air, right? But if you look at like some of the basic science stuff, there's viability of virus and aerosolized particles. There's some persistence in the environment. It can reside within airborne sized particles. This is all like biological type of plausibility stuff. It can stay persistent at certain temperatures for as long as 50 days. And actually, animal models, epidemiologic data are a little mixed in like what percent transmission there can be. So again, you're talking about Ebola, which has like, you know, a 50% mortality.
Yeah.
So the conclusion, remarkably, from the CDC and WHO was to recommend to healthcare workers taking care of Ebola patients in healthcare settings to recommend against using N95s, using, you know, particle, you know, whatchamacallit, the
Like
respirators.
respirators.
Sorry,
Yeah.
the respirators, right. They recommended for healthcare workers to go into a patient's room with Ebola, right, wearing only a surgical mask. That was the recommendation. And so, and again, it was driven. You're like, how the heck? How would you do that? And there's this hilarious picture of Tom Frieden, the prior head of the CDC, um, going in to see an Ebola patient, and the guy's like, you know, wearing a hazmat suit, even though his CDC has recommended, oh yeah, other healthcare workers, they can wear surgical masks. And again, when you actually read the documents, like I did, and I wrote this little blog back in March 2020 about masks and kind of the WHO and how public health officials, you know, make no sense, or aren't really thinking of the individual. You know, here they put a lot of weight on the expense that it would take to get everyone in N95, to have them fit, to have a respirator for all these folks in these areas which, you know, are relatively resource poor. So it seems like the whole you know, group of those folks they're just saying random stuff, and it's so clear with Fauci, as you beautifully laid out in your first chapter, that he simply is the mouthpiece of what public health has decided at that very moment. So in March of 2020, nobody should be wearing masks. Suddenly they decide, no, you know what, masks are a good idea, we should, you know, everyone should be wearing masks, and we have consensus, and he rolls out and does a talking point and says some BS thing about how, you know, oh, it's to protect PPE for, it's like, are you kidding me? Cloth masks. I wasn't running around rushing to look for a cloth mask in the hospital. So
Yep.
anyway, that's a, you know, so who knows what they say. And I think, you know, what you're describing is what you've done is exactly what people need to do. Need to look at the data themselves and get a sense of what it has.
I mean, the most enjoyable part of your book is the graphs where you have the
Yes.
proclamations by, you know, some public health official or some pundits, some med Twitter pundits, you know, making a proclamation about what's going to happen if we don't wear masks, or if we, you know, and then what happens to the graph, right, to the curve of infection subsequent to that.
Yeah.
That's really awesome. But no, there are. I mean, I think there's been a variety of rationales to justify masks. One of them, you know, I mean, there are many. One of them is it's physics, right? It's physics. You put a barrier, it's physics, right? It's gonna have to, no matter, it doesn't matter, you know, if the randomized control trials don't show benefit, it's because they're underpowered or whatever it is, or but who can argue with physics? You have a material particle that has to go from one place through your nose, and if you put a barrier, you're gonna decrease, right? I mean, it's incontrovertible. I mean, that's one aspect. The other one is, you know, the aspect of the Swiss cheese model, right? The Swiss cheese, where you speak about the Swiss cheese, because that's, I think, is fairly it has purchase, I think, in people's minds. That, you know, you do all these different you take all these different measures. Neither one of them is perfect, and you know, they all have holes in them. But if you put them, you layer them on top of the other, and then you can have some protection.
Yeah. And a lot of great points in there, and I completely agree. It feels like a lot of the times these public health officials are just kind of winging it based off of what other people are saying at the moment, and it feels like there's a lot of groupthink in that community, unfortunately. As far as the Swiss cheese thing, and I think you can go back and look and see, like I do with the Surgeon General, where he was just saying anybody should just wrap a T-shirt up and put it in front of your face, like you say. That's the physics. It'll just stop things by if you put a T-shirt in front of your face. And then what I think is key to point out is their expectations early on were that masks would reduce infections by, you know, up to 85%, and that if 80% of people wore masks, we could essentially eliminate COVID. That's what was early on. That's what people were saying. And then that became, as it became obvious that wasn't happening, then the Swiss cheese thing comes in, and because it kind of was to move the goalposts a bit and to kind of excuse some of the failures of the mandates and all the universal compliance that we all saw. Everybody could see it with your eyes. You go to a grocery store, everybody was wearing a mask. But it wasn't helping. And so they moved to the Swiss cheese thing where, yeah, like you said, if we layer these interventions on top of each other, we can control COVID. And that was, I think we've seen, especially in the last 6 months over the winter, where all these areas that had the mandates, that had the layered interventions, weren't able to control it no matter what they've done. I mean, even the areas that seemingly had done a good job, like Australia and New Zealand, they're now going through huge surges because it's not really feasible over the long run to control a highly infectious respiratory virus. I think obviously these island countries are able to kind of do that by closing their borders and shutting everything down and quarantining people as they come in. But if that's not your situation, which it isn't for the vast majority of the world, you're not really going to be able to do much about it. And it's just this. It's this kind of, to me, it was a sign that it was a kind of a tacit acknowledgement that the policies hadn't worked, because that meant we had to do more of them now. And especially with how it's related to schools, I think the teachers unions have kind of grasped onto that concept and said we have to have masks because look, it's an important part of keeping schools open and transmission low in schools. So I don't think that, I think you can compare the results of all these areas that had these kind of Swiss cheese models that didn't work to areas that just basically went back to normal, and the numbers are nearly identical, or if not better in some areas. So that concept has failed too, as well as the mask mandates from early on.
Right.
What? Tell me about California. California rule followers.
Yeah.
They've got a governor who's of the right political stripe, who they have
right.
They have the great Bob Wachter at UCSF, who is constantly entertaining us with very long threads about how he makes decisions. How did California clearly must have done much better than everyone else?
Right. Well, it's very, Bob's threads always crack me up because he's such a strong proponent of vaccines, and obviously he's been vaccinated, and then proceeds to act like he's not vaccinated at all. It's like, I don't trust any of it. I'm too scared to go to indoor dining, and here's 25 reasons why after I've been triple vaccinated. It's crazy. But anyway, the data on California, it's fascinating because California for a long time was universally kind of had the same policies, but then last summer they didn't all have the same policies. And I focus on Los Angeles so much because they've been so devoted to mask mandates and vaccine passports and all these other things. And for most of last year, or at least about half of last year, LA had a mask mandate. Orange County didn't, right next door. And Orange County had much better numbers. Obviously, you could use that, could be attributed to many different factors, but what it's showing is that if these interventions were the most important thing to be doing, if they were worth the trade-offs and the costs and the harms, it should be showing up in the data where you can compare neighboring counties and obviously see an immediately clear benefit to a mask mandate. And it's not just California. I do this with like the Washington, D.C. metro area as well, and other areas. But when you look, and California is also great because Los Angeles County Public Health has kind of shot themselves in the foot. In December of 2021, they went and did a survey of, I think it was 1,500 businesses, within a week. So this was a very short time frame, 1,500 businesses, a lot of work. And they found that 95+% of people were wearing masks inside, and then cases went up 20 times higher than they were just in a matter of weeks. So even, we have the compliance numbers from an official source of the data, an official health department, and then immediately the numbers break all the records and skyrocket up anyway. So when you compare California, and I do this also with excess deaths, which is just not just COVID, it's all the totality of loss of life and above the expected level. California fared worse than a lot of states in 2020 and into 2021 when they had the most stringent policies and some of the most stringent policies in the country. When you adjust for age, the numbers have been, they're fine. They're kind of middle of the pack. It's nothing special. So, California, for all the interventions, all of the compliance that we've seen, it hasn't really made much of a difference. It hasn't made a difference when you consider the totality of all these numbers and adjusting for age. And I think it's a pretty clear repudiation of the entire rationale behind policy interventions at this point.
I love your book because it reminds us of all the insanity that's been going. It's a chronicle of the insanity. So in contrast to California, you have the rogue states, and you talk about Georgia, which in the summer of 2020. The governor filed a lawsuit to prevent local jurisdictions from instituting mask mandates. And you remind us of a headline in The Atlantic entitled, Georgia's experiment in human sacrifice. Right? Right? The state is about to find out how many people need to lose their lives to shore up the economy. And then, of course, what happens is that the curve of the epidemic passes. The numbers start to go down dramatically soon after this headline is published. It's really quite incredible. I mean, it's these, you know, your book and books like yours that are coming out now, sort of chronicling, reminding us, giving us a
Yeah.
day by day, retelling of the narrative are fantastic. But at the same time, I mean, it's really quite disturbing, as Nish said, that we put our lives and our livelihoods in the hands of people, who are winging it on the fly, um,
Yeah.
with rationales that are more and more difficult to understand. I mean, I think right now, I mean, but there's also a certain amount of buy-in from the public. Certainly, it depends on the states, but certainly in California, I think. In the blue conglomerations, San Francisco, Los Angeles, I mean, there's a huge buy-in. I mean, the mask mandate has been lifted now, the state mask mandate. You go to the grocery store, 90% of people are still masked here. And so it's become, first of all, I mean, there's part of it, I'm sure, is the insecurity and the permanent state of fear that these mandates and outlandish claims have generated. But then there's also, it's almost become, I mean, I'm trying to understand because I suspect at some level people know that these things can't really work. I mean, I mean the word. I mean, now it's even on CNN, right? You had a month ago, you had Lana Wen from CNN sort of admitting that cloth masks don't do anything and that sort of thing. So people must know, but they still wear it, and it's almost like just a sign of being a good citizen. I mean, it's no longer, we know it doesn't work, but listen, if you don't wear a mask, it means you're a troublemaker, right?
Hmm.
The mask may not do anything, but if you don't wear a mask, you're a troublemaker. You have a chip on your shoulder, and you're not going to be a good citizen that is following the science or whatever it is.
Yeah. Yeah, absolutely. I think societal compliance, it's honestly, it's a, I think it was David Hogg is kind of on Twitter all the time, who was said that he didn't want to be confused with, be seen as a Republican by not wearing a mask. And it's become this kind of symbol that you adhere to a broader set of
Right.
correct ideologies. I call it the believe in science crowd, where if you have the yard sign in front of your house that says, "In this house we believe in science," and then you have Dr. Fauci who comes out there and says, "I am science," and I say you should wear a mask, you kind of have to listen at that point. And I think you can go back and look at the media coverage, which is obviously what I try to do, and in enhancing the state of fear, where you see Georgia, this is an experiment of human sacrifice. In Iowa, welcome to Iowa. State doesn't care if you live or die. That was another headline. And then nobody kind of follows up with the results afterwards. So that became one of my goals, was to show all these times when they said we're going to have this huge surge because of removing these mandates, and then nothing happens. But they never go back and update the story and fix the headline and say, "Welcome to Iowa, a state where literally nothing happened after we removed mask mandates." And it's a very consistent pattern where, conversely, where I did this in the book as well, with Israel and India, where they say COVID was consuming India until everybody started wearing a mask, and same thing with Israel, where they're, "Oh, well, the lockdown wasn't really adhered to, but epidemiologists think that we controlled this fourth wave or third wave, whatever it was at the time, because of increased masking," and then the numbers break every record a couple of weeks later. So I think you can kind of put that on the media's feet, where they've really done a terrible job of kind of giving proportionality to saying, it's just like, well, you could say the story could have just been, Georgia is taking a risky step by opening up. We're not sure what's going to happen. We'll see the results, and if they don't turn out to be that bad, maybe we can take this as good news that we can open society back up. Yeah, but they just don't do that, and I think that was one of the goals of the book, was to, like you said, to chronicle those early statements and show almost every time they were completely wrong, and they just keep repeating the same mistakes on and on and on. And it's led to these, like you said, the mandate being gone, but people just can't kind of give it up. They've been so conditioned.
They can't give it up. So I'll give you a story. Just 2 weeks ago, I was hiking with my family in a park, state park, from a beautiful day. Sunshine outside, outdoors, and whatnot. And on a hiking trail, you walk, and then there may be people walking, opposite, and you're gonna, pass each other. And immediately, right? We weren't wearing any masks, but the people passing us, immediately pull their shirt, right? Pull their shirt over their nose as they were passing, and sort of I think they were smiling underneath, but like a high. So I thought, it reminded me. Do you know? I heard. I think it's true that the handshake evolved from. I mean, it was a sign of showing that you're not armed, right? That was the handshake. I mean, I think that's the story of how the handshake developed as a sort of a social greeting. And I'm wondering if we're seeing sort of an emergence of a new kind of social greeting where it's just pulling your shirt over your nose, you pass somebody and that means, I'm not going to infect you, except that it's a little bit ambivalent because it may mean I'm not going to infect you, I'm protecting you, but at the same time, it may be I don't trust you, I don't trust who you are, and I'm going to cover my nose because, you may be a germ emitting organism and that sort of thing.
I
It's
certainly hope
bizarre,
I certainly hope that doesn't become a consistent trend. And a lot of jurisdictions, and I can't remember a specific example off the top of my head, but I feel like there were a couple at least that had rules against wearing masks in a lot of public places because of concerns like bank robberies. People would go into wearing a mask to hide their face. So obviously there's a lot of other negative side effects to mask wearing that nobody has really been willing to discuss. And I think that's another key failing of the public health bureaucracy is that there's been a complete lack of interest in any trade-offs. Every policy has a trade-off, right? There's a benefit and a harm. And so, there are harms to mask wearing, especially for kids in schools, but in the general population as well. It's dehumanizing to some extent, I think, and it also impedes communication. And I think there's been a really a surfeit of kind of research done on the negative side effects of wearing masks in the general population. And it's concerning to me, and especially in California, where Gavin Newsom has basically said, our endemic plan for COVID is setting the stage for kind of permanent masking, where every winter or whenever the numbers go up or there's a new variant, we might reinstitute mask mandates because it's, we're never going to be out of the woods. Well, that's not endemic strategy with living with COVID. That's just kind of continuing to commit to something that we already know has failed in the state of California. So yeah, I hope that obviously none of these changes become permanent. I hope that as we get further away from March 2020, there will be more research and kind of scientific research done on the downsides of all these policies.
Right. Although I've learned that there's one incontrovertible benefit of wearing a mask, especially wearing a mask in your car. The other day I received in the mail a citation from the city of San Francisco for red lights, camera, traffic tickets. So I was like, I couldn't, I was like, no, that can't be me. It can't be me.
Right.
So sure enough, there's a link. You can go on their website, and then you can see the video footage, right? The video footage. And I wish I had been wearing. I was wearing a mask that day because then, if you wear a mask, then you had to stand a chance to go to the court and and claim that it's not you.
Now, Ian, and you were talking about these trade-offs and the negative effects of masks, but you clearly don't understand how this works, Ian. Remember, masks are like parachutes. And so, what we need, Ian, are randomized controlled trials to show that masks are dangerous, or that shutting down businesses or any of these lockdown policies have any, because we don't know. I mean, we don't know. We can't possibly know the dangers of all these interventions unless we do a randomized control trial. But we don't need to do any. We don't need to do any real trials to show that they work because they're parachutes.
Exactly. Right. Exactly. Yeah.
So again, I got to stop repeating how wonderful of a job you've done in terms of chronicling this, because you're doing the job that the media should be doing, but they're too scared, or critical thinking. I have no idea. Critical thinking isn't their strong suit. But you describe in this great chapter on comparison between governments, and this may have been some of the genesis for why masks came to America, right? That there was this little bit of a paradox. It's like, what the heck? Italy got hit. Italy got slammed. New York City got slammed. The United States metros, because everyone from New York immediately spanned out across the country. Everywhere else in the U.S. is getting slammed, in some type of rolling fashion or the other. And then South Korea with their testing everyone and masking, and Japan and stuff were doing well. And of course we had the great Satan as president, and which led to the Philadelphia Inquirer headlining a story: Japan crushed COVID-19 by masking, while Trump mocks masks. There was this massive desire to hang everything on the failures of that man to do what he was supposed to do. And one of those things, gosh darn it, was masking. He was not, if he had just slapped on a MAGA mask, a million people's lives,
right.
would have been saved. And then you describe, and you and you very nicely show, and again, I haven't seen this by anyone else, right? That Japan, which was crushing COVID, like everyone is crushing COVID until they're not, right? And it's like, what happened? Did they like stop wearing masks? Like, why did this suddenly happen? But so play devil's advocate. Why do you think everyone was so quiet until they're not in these other countries?
Yeah, it's a really interesting question. I think, Japan seemed to benefit from a possibility of pre-existing immunity. There was a study by Professor Francois Boulou that covered the kind of cross-reactive immunity from other coronaviruses, and it's possible that the Asian countries had a greater exposure to and had greater cross-reactive immunity, and then as other variants kind of emerged, that immunity was less protective, so their numbers kind of skyrocketed. And obviously now they've gone much higher than they were when I had to submit the manuscript of the book. It's much higher even than it was then. So I think that might be part of it. It's obviously not mask wearing, and that was the point with the chapter with the flu as well, to show all these areas that had totally different mask policies all saw the flu go away at exactly the same time. So it's impossible to attribute it to that when Sweden has no flu and Japan has no flu, and both of them have. You can't be more different in terms of mask compliance in those two countries. So that's my assumption. I don't know that we'll ever get a perfect answer, but that's my best guess.
Why stick to the narrative that masks and MPIs? I mean, we switched presidents, we did everything. We switched presidents. The president's been wearing a mask every time, everywhere he should be wearing a mask, I guess. And despite that, we've had these large outbreaks in the US, elsewhere. I mean, I think Joe Biden said something about 100 days, right? If we just all mask for 100 days, and Nassim Nicholas Taleb mathematically tried to prove that as well. If we masked for 100 days, everything would be okay. It's amazing. But all these things kind of fall through, yet we have public health still kind of doubling down on masks. Why do you think that is?
I think there's a lot of sunk cost fallacy, which is, we've been doing this for so long. We've committed so many resources to it. I briefly cover this in the book, and I'd like to do more even of it, but showing there were tens of millions of dollars spent on advertising for masks. I mean, there was an ad campaign in California where you'd see an elderly woman in a hospital bed on like a ventilator, and it would be, wear a mask so that this isn't your grandma. I mean, that's the kind of manipulation and advertising that we were seeing. So I think that once they kind of committed to the idea that it was the most important thing to do, that it was the most important policy tool, and really allowing the public to shame and police others for not wearing a mask properly, it became this kind of snowball effect and self-fulfilling cycle where all of these different governments and experts had sold it for so long, and as the numbers were going up, they have no excuse but to kind of keep promoting it and saying, well, it's not our fault, we recommended it properly, but you guys just aren't complying well enough. And now that's another kind of dangerous aspect of this, is that there was always this line about compliance not being high enough, and that's why it wasn't working. And I think I briefly touched on this in the book, but when you could say that maybe, okay, well, Alabama or Mississippi or Kansas and all the Trump countries, he wasn't wearing a mask. It's his fault that they weren't wearing masks. But when you go look at Spain and Italy and France and like we mentioned a minute ago, Japan and South Korea, all these areas where clearly, we know not that people were complying there. It's not like nobody was complying around the whole rest of the world. You can see how little difference there is and how it doesn't prevent these outbreaks. So I think it's MAGA. The MAGA folks are like Pittsburgh Steeler fans, right? They travel a lot. Everyone knows MAGA fans, from Pennsylvania. They're always off to Majorca, Spain, and Germany and Japan. And that must be what must be kind of huge
doing
Trump base in Berlin and Milan. Huge amount of Trump supporters in those areas.
Um, the do you see I guess have you are there you received I mean you kind of networked with a group of folks, right? The group is called Rational Ground, correct? Can
Hmm.
you talk a little bit about Rational Ground? I don't know much about it at all.
Yeah, it kind of came together organically in a way where Justin Hart and Aaron Ginn kind of put together this group of people that were just kind of talking about this policy, and we're more skeptical of how effective any of these interventions were early on, which was heretical back then. And it was just an idea to kind of connect people that uh, were looking at the data themselves, and we're looking at the information and trying to either impact kind of local politics, provide data to other people that were curious about it, and provide kind of a one-stop resource, and also just to share ideas into theories and kind of discuss things openly in a way that wasn't allowed in the public at that point, where you just couldn't criticize lockdowns or masks or anything like that. So that was the idea, and it's been a very valuable resource just to bounce information off of, and I've learned a ton from people, and also had a ton of people that shared stories of their own personal experience and shared stories of other countries and their impacts have been and policies have been in other areas across the world. So it's been great. I think it's been a very valuable thing to and also to show, when one of these experts or politicians would come out and make these statements, you could kind of go to other people and say, well, what do we have, or what do we know that can combat what they're trying to say, or the fear they're trying to spread, or the goals they're trying to promote here. So yeah, it's been a really good resource.
The you know the attacks, the from the folks that disagree, we'll say that these are everything everything that folks that are against mask mandates and masks is cherry picked, and that the consensus is clear, and the consensus says masks work. How does one go about rebutting that? I mean,
Yeah. Well, it's hard. I mean, I think that the goal with the book was to show there's something like 120 charts in the book, and so obviously it's not just one or two examples. It's a lot. It's a lot of examples, and it would be obviously it's very easy to say that if there was, oh well, this one chart shows this is the one chart that shows the masks don't work. But when you kind of view it in totality, I think it's pretty clear that it's not cherry picked, and you can go look basically anywhere on Earth that essentially everywhere has now seen a surge. Pre 2021, not everywhere had seen a surge. Everywhere now has seen a surge, and everywhere that has tried mask mandates, essentially, other than just literally probably Sweden and a few U.S. states, really. Basically, everybody has tried it, and it hasn't worked anywhere. So, yeah, it's hard to. You can't really say it's cherry picked when everybody's doing it and it's still not working.
But on the other hand, the claim that the consensus is clear is actually true, because the consensus from professional public health people, I mean, people who are employed at, heads of county public health department and whatnot, they've all been on board with this. I mean, very few of them have raised any fuss, right? Raised any voice against these mandate policies. So I don't know. I mean, it's just a mindset. It's just about professional interest or mindset or groupthink or whatever it is.
Yeah.
That the people who are in charge of these programs are in these positions are going to be doing these I mean these experiments, these sociological experiments, without batting an eyelash, and convinced that they are doing good for the community. And
Yeah.
there's no way to reason them out of this. I mean, one way they will say is that, I mean, I can sense that in a way they don't really care, because not doing anything is also in a way, or not having mandates and whatnot in the face of an epidemic is also an experiment. I mean, in a way, it's not. You can't repeat history, right? It's always different. History is always different. I mean, you can't. There's no controlled trial of, a perfect thing that would apply at this moment to tell us whether mandates are good or no mandates is better, right? So they can say that our side doesn't also have, if they can always claim that if we did it our way, it would be worse, right? They can
Yeah.
claim that. I mean,
Well,
the fact that they're past predictive record has been terrible,
Yeah.
doesn't dissuade them from saying, still at this moment, do it my way, right?
Yeah. Well, and that would be one thing I would respond with was, what have you gotten right? Show
Right,
me where
exactly.
you were
Right.
right about this. It's also you can just as easily have said the exact opposite. It might have been better if nobody had worn masks. We don't know. It's
Right,
just as
right.
likely as the other side. And it's also I think going back to what you said a minute ago about how a lot of the public health officials there's been a consensus. Well, so if there's a consensus among public health experts and medical professionals and all these other areas that masks work and mask mandates work, uh, there's going to be no incentive for somebody to be doing a really scientific controlled trial to show that masks don't work.
Hmm.
What's the incentive
Right,
structure there?
right, right.
A lot of the public health bureaucracies get their funding from National Institutes of Health. Well, when the National Institutes of Health is saying, or the CDC, when they're both saying masks work, and we know it's scientifically proven because we put masks on hamsters and it stopped some droplets, what's your incentive to go against them and study that in detail and try to prove them wrong? So it's kind of a catch-22, and also a hypothetical I like to play with. It's like if masks were so scientifically proven and it's just it's so common sense that they work. Like Fauci says, common sense. If you wear 2 masks, you're going to do even better than wearing 1 mask. How many tens of millions of people have died over the last 100 years from respiratory viruses because this common sense tool that is just basic physics that stops the spread of respiratory viruses, we weren't using it every single flu season. And there were pandemics in the 1950s, there were pandemics in the 1960s. How many people died because medical professionals and public health experts weren't recommending this common sense, scientifically based,
Right,
evidentiary based
right.
tool? Nobody really nobody answers that question. I've asked it multiple times, people that have been arguing with me, and I've never had a good answer. What's the number?
Yeah.
And like going back to the thing, I mean, again, community masks, how masks are worn in the community and how masks are worn in healthcare settings are very different. I mean, when we wear masks going into a patient's room who has something that up to now was considered, droplet precaution, and you had to put a mask on to go in there. There's a box of masks outside the room. You take a mask, put it on, go in, do what you need to do with the patient, and as you're leaving the room, you throw the mask out. That's a very, very, very different thing. Very different than what's going on in the community. I mean, in the community, my goodness. I mean, I'm in the community, right? When I'm wearing a mask around, like God knows how many times I've touched the mask, and I'm trying not. I'm semi-trained not to try to do that, but I can. The thing's slipping down. It's very hard to do. I don't think it's even if what they're saying is true that droplet virus is carried in the droplet and the droplet is what gets stuck and it reduces transmission. It's not perfect, Swiss cheese, blah, blah, blah. My God, it is incredibly hard to do that 24/7 or whatever, or the waking hours of the day that we have.
Oh yeah.
And then you boil down to, like, of course, children. It's like, what the heck? Or, I mean,
Yeah.
I can't even understand that.
Well, I mean, I was going to say, you go back and look at all these videos of Fauci, how many times when he puts masks on at an event or at Congress or whatever, how many times he's touching it and adjusting it himself. Yeah. I mean, it's constant. And it's like, again, nobody thinks about that. Nobody talks about it, that even if it was going to work, it would have to be used properly. And even he can't do it in public.
It's mask theater.
It'd be very difficult. The funny thing, of course, is that some of these, common sense, super smart people are like, clearly, like the Bangladesh masking study came out, right? The big RCT, right? And Ben Recht, immediately wrecked the, I would say, I don't want to be too mean, because we did have Jason Abeluk on, and he was very gracious, and he spent hours with us, and well-intentioned, etc. But I think we can fairly say that, like, the differences seen in intervention versus control arm were very, very, very we're small, and despite despite all that, to end up that we end up in this world where we're talking about we're using studies like that to mask, and we then don't we at the same time say, okay, the Danimask trial, which is the Danish, the only other RCT that's happened so far, is that was a negative trial for masks, but there are problems there. People didn't wear a mask correctly. I mean, it seems so clear that it's the ends that are kind of driving all of this. How you interpret the research and stuff. One last thing, let me because this will definitely come up. of course, again, the ad hominem attack that's lobbed is that, these are fringe groups, they're right-wing groups. When Josh Stevenson, who again, I loved, just lots of data, rational guy on Twitter. He was part of a group that put out something on rates of hospitalization from COVID versus rates of vaccine myocarditis, right? There was this preprint, and then the world burned up because of that paper. And one of the reasons, and it's insane, like there's this long interview by David Gorski from Science-Based Medicine, and his comments are basically that, well, Josh Stevenson lists on his thing, he's a team member of Rational Ground, and Rational Ground is a well-known anti-lockdown, anti-mask group. So the funding, how much funding are you getting from the Koch brothers? That's what I want to
know. I'm giving you a lot, tens of millions of dollars.
Are you giving this interview from Mar-Lago?
Yeah, yes. I should turn the camera around so you can
Where's
see Donald's. He's right here. He's no, I understand that the criticisms are going to be lobbed, that it comes from a certain political mindset. I would say that the people that I've talked to, it is more predominantly right wing, but there's a lot of people on the left wing that have been very frustrated with the policies and have been very frustrated with the mandates and don't believe that it works. And I think in a lot of cases, people on the left have spoken even more eloquently about it because they feel like it's a kind of a betrayal of their principles, of what they thought that ideology stood for. And I think that what we've learned over the last couple of years, and I know this from personal conversations I've had with people that have very much involved in determining national COVID policy, that the data and the evidence that was being used by people like Dr. Fauci and Deborah Birx is exactly the same data and evidence that any of us are using when we're having these discussions. There was nothing different that they had. They had no specific information that we're just not privy to, that they had access to, that showed that any of these measures would work. And so, anybody can look at this data and evidence and come to these conclusions. And I think that anybody that comes to it with an open mind, would be stunned. I think a lot of the reasons why these policies have persisted for so long is because people are just not aware. Like you said, that this should have been the media's job, and they just haven't done that.
Right. I'm sure the other response that's going to come is that, well, we knew this already. We all need to be wearing N95s, and the kids need to be wearing N95s. So all of this is surgical masks. So what framework? And this is where I think what Michelle says is very important, because Michelle gets bored. Michelle's older and he has trouble paying attention to start saying numbers, and Michelle's like, oh my God, this is just, I'm getting bored here. Michelle comes of this not from an empiric view. He says, look, even if you had a mask that did, reduce case counts by 10%, I don't care. I want to see my kids' faces, and kids should be able to see other kids and play and stuff. But how would you, as a data guy, how would you kind of answer the demand for 5-year-olds and up to be put in N95s to truly control and crush COVID?
Right. Well, obviously, it's completely ridiculous to assume that 5-year-olds would be able to maintain a seal around their face for any period of time, and even if you could, it wouldn't be worth the trade-offs, because the kids are at such low risk of COVID that it's not worth it, even if they could marginally reduce anything. The other thing I think is that we have kind of real world evidence on what population-wide N95 level mask mandates have accomplished with Germany and Austria, and both of those countries have seen huge surges well after the record-breaking surges by their standards. After implementing these higher quality mask mandates. In Germany, the states that had the highest quality mask recommendations did worse than those that were requiring surgical masks only. So, it's all, in theory, everything sounds great, but in practice, what we've seen is the results haven't really been there. And if the results aren't there for the entire population, there's no way to justify it for kids, of course, since they're at the least risk. And since there's been a lot of data that's put out there that's with schools being open have actually led to reduced transmission in some areas, or they've had lower rates for kids that were actively in school versus those that were virtual learning. So yeah, it's just ridiculous. The push for N95s is to me I keep waiting for them to have this jump the shark moment when people finally wake up and say, we're done. This is too much. We've gone too far. So my hope is that that's it. You know, the N95s are it. We've moved from one mask, put a T-shirt in front of your face, to no, need a cloth mask. Then it's double cloth masking. Then it becomes surgical and cloth. Now it's N95. It just, you know, it's kind of this, as the results have shown, it's not working. They keep going further and further, and N95s to me are kind of the logical conclusion of this absurdity.
So great. Well, we've taken up, Michelle, we've taken up a ton of your time. Thank you so much for the book, for all the work you've put in. Thank you for spending the time with us. And you know, it's I can't say it enough that, you know, you read your book and it's a very, very compelling case. I hope folks that really believe in masks and mask mandates really, you know, give it a read, because certainly it should seem to most folks that are even mildly objective that you raise some serious concerns about how effective, you know, masks in the community and mask mandates have been, not just in this in the United States, you know, state to state, county to county comparisons, but also you know, looking internationally. So thanks so much, Ian.
Yeah, no, thank you very much, Ian.
I
want to just, you know, again, say kudos to you for doing this, and you and other people who are non-medical have done really great work during the pandemic, highlighting all the you know, just pulling the veil, or pointing out that the emperor has no clothes. You know, people like you, journalists. We had David Zweig on the show. You know, people who are not, the medical profession by and large. I mean, most of us have been. I mean, some, you know, some have done good work. Anish and others like him like to get into the weeds of the numbers and whatnot. It's not my style, but people like you have done great work, which is important because it shows that it's not. It demystifies a lot of that stuff, right? I mean, if you guys can get it right and show it in a very convincing manner, it demystifies it, and it really takes the wind off the sail of these people.
Well, thank you both very much. That was very, very kind. I really appreciate it, and I agree. That's the goal, is to show, you know, anybody could have been doing this. If it had come from a doctor or as experienced public health expert, the numbers would be exactly the same, because the numbers are the numbers, and that's the point. Is you know, none of this is my own opinion. It's not editorializing. At least the data is not editorializing. It's all there. Anybody can show it, and that's, yeah, I completely agree, is the democratization of it, and hopefully that, I'm glad you at least believe it was successful. I hope other people do too.
It really was. Your Twitter handle, Ian?
It's Ian MSC.
We'll have that on the show notes. We'll have a link to your book, and we'll have a link to you know, the article that Anish mentioned that he wrote on masks, which was really quite good back then. Thank you very much.
Thank you.